as we enter a new phase of the pandemic now, it is still important to thank those healthcare workers who put everything on the line to help.
Amen to that. But sometimes the most essential of essential workers can be easily overlooked. Tonight, 3 News contributor Chris Webb tries to make that right and introduces us to one local woman who is a bona fide hero.
When I first came in, I was nervous to talk to patients and get to know patients. But now I opened up more. And when I train the new employees that come in, I tell them, like, your main goal is to interact with your patient.
When you think of an essential healthcare worker, you probably think of someone putting themselves at risk to provide care for those in need. If that's the case, then you should definitely think of Shantel Hicks, a Cleveland Clinic environmental services worker who is one of millions around the country who also work on the front lines of our healthcare system.
My mother-in-law actually works the same job that you work. I hear firsthand just how heavily involved the job is.
Yeah, my job description before COVID, I was still environmental service, but cleaning patient rooms, greeting them, making them feel comfortable while they're staying there. I think you should have a connection with everybody that come inside of the room. Because when you're in a room, that's like your home. So I think anybody that come inside your room, you should have that connection with them.
How did your job shift as a result of this pandemic?
COVID did a lot. Cleaning more, PPP, we gowned up more, gloves, hand sanitizer. I had some patients that just couldn't move. That's what made me want to go in the rooms more, seeing them not being able to move and do for themselves. It just touched me a lot, so I just felt, what if my family got it? Would I treat them different or anything? So I just was going in the rooms every day. One of my patients, I was just talking about it, he was an older man. He liked his hair brushed and combed. Me not thinking that it's COVID, I will always go in there and brush and comb his hair for him because he liked his ponytail done. When I come into work, all I was caring about was the patients at that moment.
And her care will soon translate from environmental services to a full-time career.
Now I am in Bryan and Stratton College for Medical Billing and Code, in which I graduate May 22nd of this year. A lot of people think it's easy, but it's really not easy. You really have some housekeepers that care for their patients.